300 million people globally suffer from depression. Depression is one of the largest illnesses in the world. Illness. That's the word we need to focus upon. Depression, like any other medical problem, happens because of certain combination of factors. And primarily, depression happens because of certain chemical changes or neurotransmitter imbalances in our body. Let me give you an example. How does diabetes happen? Insulin in our body becomes less. So the medical treatment is to ensure that the insulin is on track. And that's how diabetes becomes fine. Similarly, in depression, neurotransmitters like serotonin, they become less. When they become less, you have depression. So what does that mean? That means depression is not a matter of choice. Depression is not a matter of individual fault. It's not a matter only of circumstances. In fact, psychiatric disorders, we try and understand them by means of a biopsychosocial model. Bio, which is genetics, neurotransmitters; psychological, which is our personality, how we interface with problems in life; and social, which is our environmental factor. Now, both the treatment and the cause now become related. So how do you treat depression? You treat depression for the biological point of view, medications. Psychological point of view, cognitive behavioral therapy, dialectical behavioral therapy, other forms of counseling and psychotherapy. And you garner the social support, the environmental support, help people deal with the stresses. That's how you work on the social component. So the biopsychosocial model, both to understand the illness and the treatment. Let's now understand, how do you identify depression? Sadness of mood, loss of interest, loss of pleasure, not able to enjoy things that you were earlier enjoying, feeling low, feeling fatigued, difficulty to concentrate. Thoughts like hopelessness, I feel that there is a darkness in the future. Helplessness, I feel nobody can help me. Worthlessness, I feel bad and inferior about my own self. And you may also experience thoughts that life is not worth living, sometimes thoughts of self-harm. These symptoms, most of them, when they are present for about 2 weeks, and they cause socio-occupational impairment in functioning, meaning they impair your life in terms of how you feel about yourself, how you are engaging with the social friends, peers, workplace, or your academics, or your work, your productivity. So life starts having functional impairment. That's how you understand depression. And when you have this, what do? Talk to someone, unmute yourself, go speak to someone, garner the social support, friends and family. Talk to your general physician. Your general physician would be able to tell you whether you need medications, whether you need an expert opinion of a psychiatrist, whether you need psychotherapy with a psychologist. Do that. And then whatever treatment is offered to you, go ahead and take that treatment.